Good afternoon. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the HCAI Certified Wellness Coach Employer Support Grant Program webinar. Before we begin, I would like to discuss a few housekeeping items. Number one, our webinar is hosted in Microsoft Teams. If you are not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen. Number two, this webinar will be recorded and posted on our website in approximately 7 to 10 business days. Number three, today the chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. And number four, today's webinar will focus only on the HCAI Certified Wellness Coach Employer Support Grant Program details. We understand that some of you may have questions regarding the broader Certified Wellness Coach program, and we are happy to answer those through email, but today we ask that you limit your questions to those focused on the Employer Support Grant. Thank you for your understanding and cooperation in this. Here's today's agenda. We will have some opening remarks from our Assistant Deputy Director, Sharmil Shah, followed by an overview of the Certified Wellness Coach profession, a description of how the Employer Support Grant works, details on the application process and scoring of the grant applications, and then you all have a chance to ask questions from our panel. And with that, I am thrilled to introduce Sharmil Shah, Assistant Deputy Director for Health Workforce.
Good afternoon, everyone. We are so excited to see this amazing turnout for today's Wellness Coach Employer Support Grant webinar. As Chris indicated, I am Dr. Sharmil Shah, the Assistant Deputy Director for the Office of Health Workforce Development here at HCAI, and it is my pleasure to welcome all of you today. As you know, youth in our communities are struggling with mental health challenges, and the need for prevention-related behavioral health services has never been more crucial as it is today. We are proud to introduce this new profession that we believe will help address these challenges and be the upstream solution our youth so desperately need. You, as employers, will play a critical role in the recruitment and hiring of certified wellness coaches and bringing this workforce to our youth across the state. For that, I am truly grateful for your participation in this very important webinar. I wanted to ground us a bit in the mission of our department. HCAI expands equitable access to quality, affordable health care for all Californians through resilient facilities, actionable information, and the health workforce each community needs. Next slide, please. The Office of Health Workforce Development strives to fulfill that mission by supporting and increasing a health workforce that, one, serves medically underserved areas, represents the California it serves through racial and language diversity, and serves Medi-Cal members. Health Workforce Development also offers programs that provide financial support for organizations who would like to expand educational capacity, individuals to pursue health careers like scholarships and loan repayments, and organizations to build the workforce pipeline. Before we jump into the actual content of the Wellness Coach Employer Support Grant, I would like to introduce our policy analyst, Ben Gamache, to provide a brief overview of wellness coaches.
Well, thank you so much, Sharmil. Next slide, please. So the need for certified wellness coaches came about from the governor in 2021 and part of the Children and Youth Behavioral Health Initiative, which was a historic $4.4 billion investment to transform the behavioral health system for children and youth. This included an establishment of a certified wellness coach profession. And as Sharmil mentioned, this is a focus on children and youth from underserved communities, which is a tenet of HCAI. And we are committed to ensuring that certified wellness coaches contribute to the broader goal that children receive appropriate, timely, and effective behavioral health services and supports. One thing to clarify on this, when we see the term certified wellness coaches, and I'll talk about this in future slides, the term certified is because HCAI is the certifying entity. I know we have a lot of educators and education-related organizations in here, so this is not meant to be referencing anything in terms of certificated versus classified. So just want to clarify that distinction, that when we say certified wellness coaches, we are referencing HCAI certified. Next slide, please. So as part of the Children and Youth Behavioral Health Initiative, there are many, many work streams. You can see that they cover a large expanse of workforce training capacity, behavioral health ecosystem infrastructure, coverage, and public awareness. This is really just meant to be illustrative that we're only talking about the wellness coach workforce today. And while there is some intersection with some of these other workforces inherently, because it's part of the broader CYBHI, today we're really just addressing this workforce training capacity aspect that is the certified wellness coach workforce. Next slide, please. This slide is a theory of change, which is essentially just a conceptual model of the how and why for the certified wellness coach profession. So you can see here, these are our broad activities that HCAI are going through in developing out this profession, as well as some of our early outcomes and our bigger downstream outcomes that we're hoping to either contribute towards or to accomplish. So you can see there's many different things in the activities, but the thing we're really focusing on today and calling out is the second to last one, that is offer employer support grants to organizations. And we'll talk about this a little bit more. These grants are specifically designed for our schools, school-based, school-linked organizations with a focus on high-need communities. And the early outcome with that is that we are looking to generate demand for this CWCs, aka Certified Wellness Coaches, in public education and school-linked and school-based organizations. The hope, of course, with all of this is that we're creating a sufficient and diverse workforce that provides behavioral health prevention and early intervention services for California's children and youth, eventually contributing towards the improved overall mental health and well-being for those children and youth. So again, main outcomes here are the supply and the demand. And of course, today we are focusing on our grant, which is part of that general demand. Next slide, please. So many of you here have probably been following along on the wellness coach development, as well as many of our presentations. But this is, again, it's just to ground us in the services and competencies of this role. As I mentioned earlier, this is part of primary prevention and early intervention services. And so we can see here that the main scope of service for these individuals is wellness promotion and education, screening, care coordination extension, individual and group support, and crisis referral. You can also see here that there's additional competencies. Looks like the slide just went down for a second. Okay, great. Additional competencies. Again, we are really looking at that representative workforce. So cultural responsiveness, humility, and mitigating implicit bias is a very important tenet, both of this workforce and HCAI in general. Of course, being apprised of professionalism, ethics, and legal mandates, really strong communication skills, and then being able to operate in this role in different environments. And I will talk about this in our next slide as part of our certification aspect and how we actually take the individuals through this to become certified. So next slide, please. Currently, there are two different pathways towards certification. The first one is our education pathway. So we do have two rungs of profession for the wellness coach, our wellness coach 1 and wellness coach 2. And in order to qualify for certification, the individuals as a wellness coach 1 must complete an associate's degree. We are currently working with our community colleges to develop out these programs, but right now we are also accepting throughout the state at community colleges associate's degree with the focus on social work, human services, and addiction studies. And the reason that we are focusing on these particular fields of study is that there is a field experience often embedded as part of their programs, and that field experience, that supervised experience, is a really important aspect of this role. These individuals do need 400 hours of field experience, and we'll talk about this in a subsequent slide as well, but that can be a combination of hours that are generated from both the degree program as well as volunteer and on the job. For our Wellness Coach 2, they require a bachelor's degree in the same fields, but they have an additional 400 hours of field experience. Individuals can enter directly into their Wellness Coach 2 program as long as they go through the entire Wellness Coach 1 education requirements throughout the course of their study, as well as meet all of those field experience hours. And then the hours from Wellness Coach 1, should an individual do that prior, does apply towards the total of the Wellness Coach 2 as well. So next slide, please. In the education pathway only, we are also offering an opportunity for individuals to apply for certification before they meet that full 400 hours. So those with at least 150 hours can apply to be a certified wellness coach with a registered designation. And those for Wellness Coach 2, they can apply with at least 300 hours to be a registered Wellness Coach 2. And these specific types of certification will be noted on their certification once it's approved. And the reason we're kind of offering these types is that we really want to provide the opportunity, knowing that that work experience is extensive, so that individuals, as long as they meet those minimums in their degree program, they have the opportunity to be certified and then go enter into the workforce to finish up the remaining requirements. Again, all individuals are certified, and we'll talk about this later on in our grant details, that we are also offering opportunities for organizations that would like to augment the training. We have internships available to bring on these certified individuals. Next slide. For many of you, we also have a workforce pathway because as we continue to engage with our education community, we really have heard that there are many people doing very similar roles as the certified wellness coach now. So what we've offered is the workforce pathway, which is for professionals who are currently part of the workforce. And because of that, we're expanding on the degrees to accept additional degrees, including child development and early intervention, psychology, and sociology. These generally have less field practicum embedded as part of their degree program. And so because these individuals in the workforce, we're really looking at their work/field experience as a way to ensure that their competencies are met. So individuals for Wellness Coach 1 will need to work in the field for about 6 months of full-time work, which is about equivalent to 1,000 hours. And Wellness Coach 2 is about a year of full-time work. And these must be in the fields of mental health, social work, child welfare, and or addiction and substance use. And again, these hours can be through any combination of relevant hours in a degree program, volunteer hours, and or on-the-job training hours, but must be within 2 years of certification. So again, this is really for our current workforce. And we should also highlight that we are not requiring individuals who are already doing this. We're not requiring employers to change them to the title of wellness coach, certified wellness coach. This is really to just augment what they already have for their current employees. So that could be, family, youth, and liaison, for example, with a certified wellness coach certification attached to that. Of course, for those that are looking to bring on new employees as part of their workforce, then of course they can bring on the new title of certified wellness coach into their organization. So please connect with us if you'd like to know more, if there's any resources we can provide to help you bring on those individuals into your organization. So again, we do have 2 pathways for certification, and certification will be opening within several weeks. So please stay apprised. We have many resources to stay updated. So as soon as that launches, we hope that we can have our individuals ready to apply as soon as that certification website goes live. And we do have many resources, including application checklists to support them in getting all their materials together. Essentially, these individuals will need proof of their degree, verification from their supervisors on their hours, competencies, and skill sets. And we already have those forms created, so it's very easy for our employers to provide that information. And then the individual will have to upload all of this information and then go through the certification process through HCAI, which will all be posted on our website. Next slide, please. And now I would like to hand this over to my colleague in the policy section, Ann Powell, who take us through the details of the employer support program elements and our key dates. Ann.
to thank you very much. I appreciate the opportunity today to talk about this brand new program and opportunity for our partners in schools and school-based, school-linked organizations to bring on a brand new profession to work in their settings. So the purpose of the grant is twofold. One is to provide resources to schools and school-based and school-linked health, behavioral health, and related organizations so that you can hire certified wellness coaches, as well as offer stipends to wellness coach interns, the registered wellness coach that Ben was describing earlier. The other thing is we want very important to us is to provide a bridge of funding as you prepare for the implementation of the multi-payer fee schedule that will provide Medi-Cal and commercial insurance reimbursement for the direct services provided by certified wellness coaches after this grant expires. That new reimbursement opportunity kicks off in January, and we recognize that because of that, it may take schools and their partners some time to get fully automated to that system. And so the grant runs through the end of 2025. Next slide. Thank you. As I mentioned, the grant does run 18 months. We have made available $120 million for this opportunity, and the maximum award available for the most significantly large awardee would be $12 million. It is an 18-month grant, and to be eligible for intern stipend funding in particular, I want to call out that you must also be planning to hire wellness coaches as well as your employees. And then in order to funding, the grantee must be applying for the corresponding certified wellness coach employee support and the intern stipend support. Next slide. Next slide. Thank you. Who is eligible for this grant? County offices of education are a particular target for this grant, as well as local education agencies, as long as they do so in coordination with their county office of education. And then we wanted to call out that we also want to support school-based early education centers. And this is what we mean here is Head Start types of settings. And then the school-based and school-linked public nonprofit organizations that partner with education. In order to qualify, the positions that are qualified, as we mentioned, it's the state certified wellness coach, including those that are registered, as well as there will be support for supervision provided by pupil personnel, service credentialed individuals, licensed clinicians, and personnel trained to supervise individuals who are going to be working as a certified wellness coach, providing primary and early intervention services. Next slide. Certified wellness coach employees, we have allocated up to $69,500 for a certified wellness coach 1, up to $85,550 for a certified wellness coach 2. For stipends to registered certified wellness coaches, we provide up to $6,000 for the registered certified coach 1 and up to $9,000 for registered certified wellness coach 2. For supervision provided for certified wellness coaches, we provide $6,250 per employee. And for interns, we provide up to $3,000 per employee. We also do include 10% for indirect costs. Next slide. What you see before you are the key dates to keep in mind. And I'll note that all of this information is in our grant guide, and I would refer you, as Chris did in the beginning, to our website to access that grant guide. So application opened last week. Today is the webinar. Application closing is March 15. That's approximately 2 months application period. We expect to announce awards in May and execute the grant agreements at the end of October. Next slide. With that, I'm going to hand it off to my colleague, Michelle Crouch, from our grants division or section. Thank you.
Good afternoon and welcome. My name is Michelle, and I'll be taking you through the application process and scoring. Before I begin, I need to mention a problem we're having with the profile page if you started the application. We're aware of it. We're working on it, so bear with us. Next slide. Okay, the application components. All submitted applications must contain all of the required information. The Certified Wellness Coach Employer Support Grant Program application has a total of 5 sections that must be filled out. The first is information. This is where you'll have a chance to give a narrative summary discussing the intent and purpose for requesting the grant. And it's where we collect information regarding the applicant and the applicant's organization that is applying for the grant funds. Next slide. The second part is sites. You'll list the information about the different sites and services that would be provided. Applicants indicate the number of certified wellness coaches that they intend to hire, interns that they want to recruit and pay stipends to, and then supervisors to be employed. Also the number of locations in which they will work. The next section is the budget. This section will generate based on the information that you provide as far as how many wellness coaches you intend to hire, plus the amount needed for the indirect costs, which would be up to 10%. And the budget is automatically populated based on the information that you provide as far as the number of people or wellness coaches that you intend to hire. And then once you indicate yes or no for the indirect costs, that information will be automatically populated. And if it does not, you want to click refresh, and that will then give the correct amount. Next slide.
Michelle, your camera's off.
Oh, it is. Okay. Is it on now? Yeah. Sorry about that. The next section is the required documents. You'll be asked to upload all required documents to support your application. Only the required documents will show up on the page based on your answers in the application. Like if you're a Title I or a Head Start program, you'll be asked to upload certain documents. You'll want to use an acceptable file format, which is your JPEG, your .doc, .docx, and your PDF. And in the application, it will tell you what documents and then if the upload was successful. The last part is the certification. You'll be asked to check the box certifying that the information you have provided is true and accurate, and then you'll be asked to sign the application before submitting it. Next slide. Okay, application review. At the time of application closing, HCAI will review each application for the presence or absence of required information in conformance with the submission requirements. At that time, HCAI may reject an application if it is incomplete. HCAI can also reject applications that contain false or misleading information. Next slide. Post-award and payment provisions. HCAI expects the grantee will begin performance of the grant agreement on the start date listed on the grant award documents. At that time, a single payment equaling 25% of the total award will be made upon the grant agreement being executed. And then HCAI makes payments in arrears upon receipt of the biannual budget and activities report and expenditure documentation. So every 6 months, there'll be a report that you'll have to complete to make sure that you're, conforming to the requirements stated in your grant agreement. And then at that time, you'll provide any expenditures that you've gone through, and then HCAI will make a payment on that. Next slide. You'll receive payment from the state controller's office. They mail a paper check directly to the grantee's address on file. So please ensure that HCAI has your most recent and current address on file to avoid a delay in your payment. HCAI reserves the right to recover monies for a grantee's failure to perform service and other grant agreement obligations. And what this means is if at the end of the grant that you don't comply with the requirements of the grant, it's possible that you would have to repay some of the money that you have received if you do not fulfill your obligation. And I believe in the grant guide there is a section on the breach policy. Next slide. Evaluation and scoring procedures. HCAI will use the evaluation criteria described in the grant guide to score applications. HCAI also intends for certified wellness coach providers to support a geographic distribution in California. Applicants seeking to support geographic regions not addressed by other similarly scored applications may receive preference. And what that basically means is that if you have an application from Los Angeles, say, and one from maybe a rural area that wants to put providers in those areas that aren't accessible, they could receive preference. Next slide. Okay, scoring criteria. Applicants will provide the total number of certified wellness coaches that they will employ and the number of schools that they'll offer services at. And for each certified wellness coach that they intend to hire, they'll be given a point up to a total of 40 points for this section. Applicants will provide the name and address of each site that will offer certified wellness coach services. And we will calculate the percentage of schools or locations entered that are either Title I or a Head Start. And if it's equal to or greater than 50%, you'll receive 10 points. Less than 50% would be 0 points. Next slide. Language. You'll enter the number of staff across all sites and locations who speak or offer services in one or more of the languages listed. 5 points for those that speak a Medi-Cal threshold language. Up to 5 points if current staff speak or offer services in any tribal or indigenous language. Up to 5 points if they speak or if they offer services in any sign language, for a maximum of 30 points for that section. DEI readiness. Applicants will indicate whether they currently provide behavioral health services or whether they intend to provide these services to the LGBTQ or persons with disabilities community. And you'll receive up to 5 points per group if you do offer these services. Bringing the total amount of points that you could get to 90 points. Next slide. And this is where I will turn it over to my colleague, Christopher, who will go through the questions and answers. Chris?
All right, thank you so much, Michelle. As you can see, our team has put a lot of work into this program, and we're really excited that you've joined us today to learn more. We are going to transition to our question and answer session, and the Q&A portion of the webinar is already open, and I see people have been asking questions. You can access that at the menu bar at the top of your screen. If you do have a question, enter that in, and we will be making every effort to answer all of the questions we've received today. We will do so in the order that they have been received. Today, because we do have so many people, we will not be enabling mics, and so if you do have a question, please enter it into that Q&A portion up at the top of your screen. The first question that was asked is, will attendees have access to the recording of the webinar? And the answer is yes, you will have access to this recording. We will be posting this to our website along with the resources, including the slide deck, and we will be sending everyone who has attended an email that lets them know that the resources are posted online. So those will be available typically within 7 to 10 business days. Okay, next question is, what constitutes as a human services major? And who wants to take that?
Can you repeat the question?
Yeah, what constitutes as a human services major? I believe this was a section in Ben's presentation section.
Hi there. Yeah, so this is really an interdisciplinary degree. We often are seeing that, especially in our associates programs, that social work and human services are often combined into a single degree. And then we can see in other CSU programs, the bachelor's, that we actually do have specific human services majors. If there's any question or concern, and just not clarity rather, about if yours does apply, please reach out to us and we can do more individual discussions with those individuals.
All right, thank you, Ben. Let's see here. Get our next question. I lost my Q&A section. And we are going to open up the chat. Apparently some people are having trouble accessing the Q&A session. And so this Q&A section, and so we are going to open that up as well. If you are having trouble finding the Q&A, you can also use the chat. Okay, next question is going to be, let's see, find the next one. Okay, here we go. Are community-based organizations eligible? Is this for nonprofit only?
Yes, that is correct. The grant is only available to public and nonprofit organizations.
And a follow-up on that would be, is a private nonprofit organization eligible for funding?
Yes, as long as you're a nonprofit, yes.
Okay, 501c3. All right, are FQHCs eligible to apply?
Yes, they are.
Okay. Will certified wellness coaches be able to work outside of schools, for example, as an enhanced care management staff member?
If I understand the question correctly, you're asking if they can work outside of a school setting, or is it?
Yes.
I don't see the question, so if you could repeat it.
Will certified wellness coaches be able to work outside of schools, for example, as an enhanced care management staff member?
They can work it. All that we are interested in is a partnership with between education and community-based and similar agencies, nonprofits, and where they actually perform their duties is up to their employer.
All right, thank you, Anne. Laura Hines says that she missed how certified wellness coaches actually get certified. Can we go over that one more time?
Of course. So our certification website will be through HCAI directly. So we will be providing resource links. One of them is CAIwellnesscoach.org, which is our new marketing website, and we will be providing all of the links there. So it'll be very easy to access through that. And then individuals will have to just meet the eligibility requirements and actually go through the application process on that website directly. We will follow up with this slide deck as well that outlines the distinction between the education and workforce pathways that have the qualifications there. Also, there will just be a few forms that'll be required in order to apply. That'll also be very clearly outlined once that goes live. And then we will potentially be providing that checklist of required information before it goes live as well. So just stay tuned. Best thing to do would be to check on those resources at the end and stay updated on our mailing list.
Thank you, Ben. Next question, are sites limited to schools?
No, they are not. Schools can partner with community-based organizations, both that are school-based and or school-linked. If you have questions about that, don't hesitate in the grant guide. And at the end of this slide presentation will be an email where you can follow up if you need further information.
Perfect. Thank you, Ann. Next question from Lynn is, when requesting funding for CWC employees, do they already need to be certified as well as current employees?
Hi. So they do not need to be a current employee. We offer that opportunity through the workforce pathway for them to become certified, nor do they necessarily have to be certified when you are putting together your application. We do require that they be certified at the point of employment. As Ben has mentioned, HCAI will have a website dedicated to certification.
Right, thank you, Ann. Amy asks, does the salary amount include benefits?
Yes, it does. Those dollar figures represent the fully loaded costs associated with hiring these personnel, and that's why there's a difference between a level 1 and a coach 2, is so that you can cover salaries plus benefits.
Excellent. Next question from Diane. Do Title V programs qualify to apply for this grant?
What was the first part of the question?
Do Title V programs qualify to apply for this grant?
I will admit I'm not familiar with Title V, so please send us some information at that email address that will appear at the end of the slide deck so we can pursue that with you directly.
Sandy asks, are community colleges eligible?
Yes, they are, because we recognize that community college students may be in need of these kinds of services. They are eligible.
And that also includes public universities, correct?
It would, and nonprofit private universities.
Perfect, thank you. Eric asks, can you please explain the grant-funded positions? There are positions besides CWC and supervisors that are necessary to support operations, including various administrative staff, to oversee operations and claim the master fee schedule. Can other positions like those administrative positions to support operations be funded by the grant?
This grant includes 10% indirect costs for all costs that are not associated with the hiring and supervision of wellness coaches and wellness coach interns.
Pam asks, what constitutes a high-need community? And along with that, the two questions are real similar. So what is underserved for this grant, and where do community mental health agencies lie in this opportunity?
Two-part question or multi-part question. For the first part of the question, it's we recognize in the grant, and if you recall, and you'll see in the grant guide under the scoring criteria, eligibility or scoring evaluation criteria, we state that Title I education settings and a Head Start agencies are given extra points in their application process. And in addition, I'm sorry, what's the next? Oh, a community-based mental health agencies. What matters is that you have a formal relationship with the education institution that you would be partnering with.
Okay, thank you. Let's see. Allison asks, will you consider employees with education degrees for those already in the workforce option? Education degrees require a field study requirement.
So for this first iteration of the certifications launch, we are adhering to those degrees that are listed. That said, as we get more people in the field and more people registered and certified, we will continue to assess the needs and where we can potentially revise and adapt and expand upon that. So for now, it is as designed, but we definitely want to continue to optimize and get lessons learned once we get our initial cohorts into the field.
All right, thank you. All right, next question. The times given for the deadlines, are they Pacific Standard, Eastern Standard, or another time zone? Those are Pacific Standard.
Yes.
And then let's see, Kim asks, would the wellness coach also have to supervise others who are being trained to become a wellness coach?
No, that is the responsibility of supervising personnel that we describe in the grant application or the grant guide.
All right. Megan asks, can County Office of Education's apply for the grant and pass the funds through to sites to hire their own wellness coaches?
That is possible. Absolutely.
Okay. Let's see, next question. I don't see a Bachelor of Science or Associate of Science in Health Education, Community Health, or Public Health. And these are folks that typically serve in health coach role. Are you open to health educators as well? We hope so, is the question.
As mentioned earlier, absolutely, we would love to continue, assessing other qualified individuals. So for this first iteration of certification, we are adhering to as it's currently designed, but we definitely want to continue to have these conversations. So if you'd like to connect with us and describe your current workforce, we would love to take that information, continue to have that be part of our thought process as we move forward.
Thank you, Ben. In the scoring section, does the language of staff apply to all staff at the sites or just individuals applying to be a wellness coach?
I think that's a question for me. Can you repeat that question?
Yeah, in the scoring section, does the language of staff apply to all staff at the sites or just individuals applying to be a wellness coach?
The individuals applying to be the wellness coach, I believe. Is that right, Anne? Or is that all staff?
Let's ask Jessica to address that.
Okay.
Hey there, I'll chime in. This is Jessica Fifield. I'm one of the program evaluation managers here at HCAI. It's going to depend on the item, but it's going to specify for those. So when we're asking you to provide the total number of certified wellness coaches that you're going to employ, that's going to be specific to certified wellness coaches, not interns, not supervisors, very specific to that. But then, for example, when you answer the question about language, it will specify to enter the number of staff across all your sites and locations who speak or offer services, and that's any of your current staff at all. So it'll be very specific on the application if we're talking about just certified wellness coaches, if we're talking about just behavioral health staff, or if we're talking about all staff, then that literally means all of your staff, because we know that you haven't hired certified wellness coaches yet and can't tell us about this. So hopefully that helps.
Thank you, Jessica. All right, next question. Can we apply if we intend to certify our current workforce?
Oh, I see Anne came off. Oh, okay, I'll address it. Yes, you can. As long as you are certifying those individuals, then you're still eligible to apply. We are looking to, of course, expand the workforce. So this is about hiring on new individuals, but also to retain the current workforce as well. So both are eligible to apply as long as they receive that certification.
All right. Next question, how do I get a link to the grants? We will be posting all of the links and resources for this at the end of this slide presentation. They will be on our website as well. I believe we will post that in the chat as well, so you can click on that. Next question. So the goal is to sustain funding through being able to bill Medi-Cal and health plans once the grant expires.
That is correct. Department of Healthcare Services announced this month the unveiling of the multi-payer fee schedule for a number of profession categories. It does not include wellness coaches. That will be unveiled in January of 2025, and we are permitting applicants or funded grantees to have 12 months to put that multi-payer fee schedule into place to continue supporting these positions once you've got them on board. And you can add to your workforce at any point after the fee schedule is in place. We just require that you employ the number of wellness coaches for purposes of our funding as outlined in the grant application.
Thank you, Anne. Jose asks, can you clarify wellness coach intern? Is this just an intern such as an MSW intern used in the wellness coach capacity?
I'll jump in. So our use of the term intern in this application is for individuals who have the minimum hours to become certified wellness coaches with the registration status, and that once they've earned their full 400 or 800 hours, depending if it's a wellness coach 1 or a wellness coach 2, they would then be fully certified or have completed their certification process and could roll over to be hired by the agency under another funding stream. As I mentioned a moment ago, we expect that the multi-payer fee schedule will be in place to help subsidize a portion of that cost.
Thank you. Shannon asks, will supervision by a specific provider type be required during the grant or only when the wellness coach is a part of the fee schedule?
That's a great question. Thank you for that. For purposes of this grant, we are laying out the requirements that they be clinicians, PPS personnel, and specifically trained individuals to do supervision.
Thank you. Let's see. Next question. I know that there has been a problem with the profile page. Any timeline for it to be up and running?
The fee schedule is expected to launch in January. The multi-payer fee schedule already launched for other personnel, such as the PPS individuals that I mentioned earlier. But for for certified wellness coaches, that launches in January of 2025, at which point the eligible employer can bring them on board and put that implement that fee schedule.
Thank you, Anne. And Michelle, I believe there's a question for you as far as the profile page on our application process. Oh, you're muted, Michelle.
Okay, can you hear me now?
We got you.
As far as we know, we're working on it. We don't have a timeline right now, but it is being worked on. So please be patient.
Thank you. Next question. Could a paraprofessional working in an autism program count towards hours of certification?
Hey there. As long as it's listed in the organization's, in the type of experience that we have listed on the certification slide, which again would be in mental health, child and early intervention services, social welfare, and I'm blanking on our other one, but it is clearly outlined on our certification. And as long as it's with children and youth in that capacity, then yes, that could apply.
All right. Thank you. Got a couple questions on what is meant by a school-linked organization or a school-linked CBO.
Thank you for that. I'll give you an example of both school-based and school-linked, and they sound a lot alike. So you may have Clinic ABC, who is a FQHC that was brought up earlier, federally qualified health center, who provides health services and behavioral health services on the campus of a school. That is school-based. You may have the similar organization, ABD clinic, who's operating next door off the campus, and that's considered school linked. School based means it's literally on the school grounds. School linked means there is a formal relationship between that community organization and the educational entity.
All right, thank you. And Ann, stay on. We've got a couple more questions on that. One is a nonprofit agency CBO that provides foster care and provides mental health services to our agency youth at the school site eligible. Sounds like that would be a yes.
That's correct.
And then one person is asking if they have an MOU with the school. Does that suffice for demonstrating the link?
That does, yes.
Perfect. Thank you, Ann. All right, next question. What does the up to funding amount represent in the funding category? For example, CWC1 employees up to $69,500. Is that the recommended salary for that position?
That is the maximum available per position or per role, supervising role. So for example, your fully loaded costs may not be $69,000 for a wellness coach one, but this is a great, this is saying that if it's 68,000, that's what you put in, and it will automatically from there generate your budget as Michelle described in going over the grant application.
Perfect, thank you. All right, Alicia asks if HCAI is the certifying organization for CWCs, how are field experience hours accounted for with the employer for the workforce pathway?
Hi there. As part of the application process, we will have a verification form from the employer. So this would be, again, the qualifying supervisor, and they will sign off on that form on the competencies as well as the associated skills, and then also list the amount of hours. We're also going to have the applicant in a table list out their hours that they are including as part of their application to ensure that those forms match up with those hours. So it's going to be a rather easy process. We have all the information clearly outlined, and it'll be a downloadable PDF that can easily be filled out by the supervisor to attest and verify that those hours are indeed accurate.
Thank you, Ben. Would a licensed clinician collecting hours fall into the licensed clinician PPS category, or would they fall under the certified wellness coach category?
I'm not sure I understand the question. Is this if an individual is also a clinician that would be applying for certification? But essentially the way I'm seeing it is that that clinician would be the one signing off on those hours for the potential wellness coach applicant. If, however, that question, please reiterate or reach out to us directly if that does not sufficiently answer your unique case.
Okay. I think if somebody's a licensed clinician, they would be already further along in their career than a certified wellness coach, correct? So that's
well beyond. Yeah, this is for associate's level and bachelor's level. And then also, as part of the fee schedule and other ways, there's ways for them to, of course, get reimbursed for separate services at different rates. And the wellness coach, of course, is not yet part of that fee schedule. So any, very specific questions when it comes to the fee schedule or billing, of course, can be directed towards DHCS.
All right. Question, will there be information for people interested in becoming a wellness coach? I know this meeting is focusing on the grant. That is correct. This is focused on the grants. If you do want to find out how to become a wellness coach, please go to the Wellness Coach website, and it lays out the whole process there, and we would love for you to become one. We're very excited for it. So thank you for that question. What safeguards will HCAI implement to guarantee CWCs 1 and 2 supplement and not supplant current services, resulting in current employees being displaced?
Let me speak to that. So the intention is that these individuals are serving children and youth with a level of services that are not required for licensure, and that is prevention and early intervention services. The goal of the wellness coach role is to enable other personnel working on the school to work at their higher degree and licensed or certified level of practice.
Thank you, Anne.
Yeah, and I can expand on that a little bit too. So again, part of the workforce pathway is specifically to address that. So those that are already doing similar like work, the intention is that they would not have to change their title to wellness coach, that they actually can go get certified and have this be an addition to them. We're also working very closely with our education community, connecting with County Office of Ed, to really figure out how do these individuals best fit in. For example, like how could they support the MTSS framework, and making sure that we're carving out very specific supports that are not overstepping. So we are connecting and working with those that are in the field doing that to exactly address this type of this question. So if any more information you need, please don't hesitate to reach out.
Thank you, Ben. Next question, would the grant only apply to people in wellness coach positions or similar positions with a certificate? Example was given about family liaison. I think this also touches on what we were just talking about, Ben.
Correct. As long as they're certified, then they would apply, but they must get the certification.
Thank you. Let's see. If our County Office of Education applies, would an LEA under that county be able to apply? If so, what is meant by coordination with County Office of Education?
The County Office of Education may be a direct applicant as well as a local education agency. If an LEA does want to apply, they need to have verification from their COE, their County Office of Education, that it's appropriate for them to apply. We're trying to avoid a situation where there are two applications for the same campuses.
All right, thank you, Anne. Let's see, next one. Is there any exam or competency test to be certified, or only needing to complete the hours?
Yeah, we're not including an exam and certification, and part of that was to try and reduce some of the barriers in applying. But we are, of course, because they're required a degree at associate's level or bachelor's level, looking at that as sufficient amount of examination. And also the signing off on the competencies and skill set from their qualifying supervisor is the additional aspect to completing that certification process. So we're trying to make sure that it's robust enough to really ensure that they meet those competencies and skill sets while making it simple enough that we're not getting people bogged down in very complex and lengthy certification processes.
Awesome. Thank you, Ben. And you guys have lots of amazing questions today. They still are rolling in. We're going to do our best to keep going and get all of your questions answered today. So thank you. We'll continue on here. Rena asked the question, will CWC students be able to work with adults?
Repeat the question.
I'm happy to address that. So CWCs, again, because this is part of the Children and Youth Behavioral Health Initiative, the age range is through 25. So of course, how you define adult, if that's beyond 18, that as long as it's in that 18 to 25, yes, that is part of that population. Of course, we do see that there must be some coordination with families, especially for our younger children and youth. But the intention is that this is part of our children and youth specific populations, not necessarily for our adult populations, for which there are other positions that would better be suited for that.
Thank you, Ben. Stephanie asks, coming from a small rural area, if only hiring 3 to 5 CWCs or RCWCs, will that be considered in the overall scoring because there is no way for a small rural workforce to support 40 employees in that one area?
I'm going to ask my colleague Jessica to address that question.
Hi, yeah, happy to speak to that. So the standard scoring guide gives us a way to just score applicants broadly. However, in the slides, we stated this, it's also in section H of our grant guide, that it is absolutely our intention to provide support for a geographic distribution across California. That would include making sure that we are meeting the needs of smaller rural communities, as well as other areas of unmet need, including mental health HPSAs. And so you'll see in the grant guide, it does say that if we're seeing similarly scored applicants who are not being represented because of a geographic variance, that we certainly will address that. And so for those of you that are from small rural areas, you're looking to, maybe support 1, 2 certified wellness coaches, we would absolutely encourage you to apply. You serve a vital need for our children and youth across the state. And we certainly have your capacity in consideration, and we'll have that in both scoring and making award recommendations. So, and if you have further questions, please feel free to reach out and follow up with us. But absolutely, we encourage you to apply, and we're glad that you're here.
Thank you, Jessica. Brooke asks, since there is an eventual Medi-Cal reimbursement, can this grant be used as a match for a community schools proposal?
What was the last part of this question?
Can this grant be used as a match for a community schools proposal?
There is no match requirement.
Does a nursing degree qualify under the certification requirements, a credentialed school nurse, for example?
Sorry, I was getting myself back on camera. Currently, we are just looking at those degrees as listed out. However, as we've mentioned earlier, we are absolutely going to continue to assess and look at other qualified individuals as we continue to roll out this profession.
Thank you.
Let me also augment that Ben's comment by also, you'll see a link in the resources to the multi-payer fee schedule. It may be that nursing is already addressed there, and we invite you to look at that document.
Okay. Thank you, Ann and Ben. Can the certified wellness coach be employed through a partner organization rather than the LEA? If this is allowed, can you confirm there will not be a loss of points for the CWC being employed by the partner and not the LEA?
What matters to us is that there is a formal relationship between an educational institution and a community organization. Who employs them we expect it will be the applicant. However, it may be that they contract with a community organization, and we would defer to the applicant in those individual arrangements.
All right, thank you. Let's see. Stephanie asks, if your county does not have a Medi-Cal designated threshold language, will that be taken into consideration when scoring the application as well?
Can you repeat the question?
Yeah. If your county does not have a Medi-Cal designated threshold language, will that be taken into consideration when scoring the application as well?
There are 2 other sections as far as it doesn't have to necessarily be just a Medi-Cal, but like if they're sign language or if they have a tribal. I might want to refer this to Jessica.
Yes.
Hey there. I don't know if I'm understanding the question fully either, but hopefully this helps. If not, maybe a follow-up question. We're going to be looking at statewide Medi-Cal threshold languages for purposes of this program. And so if you are employing folks that speak any of those statewide languages, even if that's not designated for your county, then we will count that. If you're asking about languages, other than, as Michelle mentioned, tribal and indigenous languages, sign languages, other languages that simply are not Medi-Cal threshold languages at all in the state of California, then we will not provide a place for you to input those, and those will not count towards scoring for this program.
All right, thank you, Jessica. This next question, can schools use a portion of the grant to purchase software for hybrid services and psychometric assessments to understand the challenges faced by the individual and to support the wellness coach?
That 10% indirect costs can be used for those kinds of expenses.
Perfect, thank you. All right, let's see. Let's see here. Next question. Seems like the grant scoring awards more points for proposing more positions and also based on linguistic diversity of current staff. Might that unintentionally favor larger employers and LEAs over smaller ones that have similar needs but less current capacity?
I think I might want to refer that to Jessica.
I think it ties into what we were just talking about too, so.
I think I might need to hear it one more time.
For sure.
Yeah.
All right. It seems like the grant scoring awards more points for proposing more positions and also based on the linguistic diversity of current staff. Might that unintentionally favor larger employers and LEAs over smaller ones that have similar needs but less current capacity?
Yeah, it might favor larger employers over smaller ones with less capacity. And so in one sense of that, we are comfortable with that to the degree that it allows this program to result in more wellness coaches being hired and placed in providing services. Also, in one degree, we are a little bit uncomfortable with that. And so, as I mentioned before, Section 8 of the grant, Section H, like Harry, of the grant guide does specify that applicants seeking to support geographic regions not addressed by other similarly scored applications may receive preference. That is our acknowledgement that in attempting to capture the full scale of this program, there might be an unintended consequence there. And if that does arise, we certainly will look to remedy that. Hopefully that answers the question. I feel like it was a complex question.
Thank you, Jessica. All right. My agency has 2 non-public schools and mental health programs. Are we eligible and how does that work? What type of work will they do? I assume that they is a certified wellness coach.
So the first part of that question had to do with non-public schools. This grant is not intended for non-public schools.
Okay. All right, thank you, Ann. Let's see, next question. Are charter schools eligible along those lines?
If they are a public charter school, they would be eligible. They have to be a public institution.
All right. Shauna asks, can you explain more about the supervision requirements and or point us in the direction to learn more about this part?
So as I mentioned, I think on my...
Oh, Ann, you're muted again.
Sorry about that. I think I've addressed this, but I'll restate that supervision can be by a clinician. It can be by PPS staff in the school, and it can be by specifically trained personnel in the skills of supervision of this workforce.
All right, thank you. Let's see, could the grant pay for transportation from field visits or training related to services certified wellness coach would provide? That would be under the 10%, correct?
Again, that would be falling under the 10%. To be really clear, we're only funding salaries and internships, stipends for coaches, and the costs for supervision of both the certified wellness coach and the registered certified wellness coach as an intern.
All right. As we get down into the questions, I'm starting to see repeat questions that we've already addressed. So bear with me as I scan to find questions that we haven't already answered. Let's see. All right, here we go. Does owning and running a wellness service center for multiple years offering mental health services to the community make us eligible for the grant application? And 2 hours work towards the individual certified wellness coach certification if the owner wants to get themselves certified as well.
I think that's a nuanced enough case. Feel free to reach out to us directly with exactly what that structure looks like, and we'd be happy to confirm that there's eligibility there.
Yeah, so Rena, if you're still listening, go ahead and email us at wellnesscoach.hci.ca.gov, and we'll work with you directly to figure out the answer for that. All right, next question. This is a good one. Are the certified wellness coaches considered more intervention focused, prevention focused, or both? If prevention, both, how is SEL worked in?
Go ahead, Ben.
So this is, I would say, really primary prevention and early intervention. So a lot of this, again, is prevention when we talk about wellness promotion, education, and then really more of those tier 1 supports. There can be some support of tier 2 and tier 3, but really making sure that it's in coordination with a qualified individual, licensed clinician, or a PPSC or qualified supervisor. I missed the second part. Of the question.
If prevention or both is the answer to that question, how is SEL worked in? I am not sure what SEL is. But,
I'm assuming they're referring to social emotional learning. So yes, I would say that there absolutely could be an aspect of social emotional learning. And we've actually done some crosswalk. For example, for those that are familiar with PBIS or MTSS, we've done a crosswalk with certain county offices and school counselors that do these types of things to really figure out where the tier 1 services these individuals could offer, as well as some tier 2 and tier 3 supports. And we've also helped draft some job descriptions in coordination with some of our county office of ed, superintendents, HR, and others to try and map out exactly what some of these specifics look like. So we're happy to send those resources along just as templates or really some information. Again, to reiterate, we're just providing a skill set for certification, and how organizations utilize these individuals is really up to them. We want to provide the broad scope that these individuals can do, but how they best fit into their supportive teams, their care teams, we really look to our employers. We are not trying to overstep and tell them what they must do. So wanted to just continue to reiterate that whether it's certifying your current workforce or bringing on new individuals to help fill out and round out broad supports, and have another trusted individual on campus, that's really the intention of this role.
Awesome, thank you. And it looks like I saw something pop up asking for that crosswalk information. Ben, would emailing us, if that's something you're interested in, be the right approach for that?
Yes.
Okay, so if that's something you're interested in, please email us at that wellnesscoach.hci.ca.gov email address. All right, can a district apply if their county office of education already have wellness coaches through school-based mental health and wellness programs?
If they already have similar personnel, they can seek support from this grant to transition them over to the Medi-Cal multi-payer fee schedule.
All right. Thank you, Anne. There is a number of questions about where to access that Medi-Cal reimbursement fee schedule. I know that we had spoke to it earlier as it's coming out later, but I noticed that there's still questions regarding that. Do we want to address that one more time, please?
There's a link in the coming up under resources that includes a link to that schedule.
Perfect, thank you. And we do have about 15 minutes left in our webinar. We're going to keep working through the questions for about another 10 of those. And we'll then go into our closing statements and resources. All right, and let me keep looking here for questions. Let's see. Let's see. Can the same individual receive both a stipend and a salary? For example, if we supported them in getting their hours and gave them a stipend, then hired them, could they be counted in both categories?
I apologize. Please repeat the question, Chris.
Can the same individual receive both a stipend and a salary? For example,
No, they
if we
cannot.
supported. All right, thank you. Okay, here we go. Next question. Fantastic. We're moving through there. Let's see here. Let's see. Answered that question. Let's see here. Okay. Good news is we're getting through them. You guys are asking great questions today. We really appreciate all of the interest and interaction. Okay, here's a good question. Can I use the certification in a mental health setting like a primary care clinic?
Yeah, absolutely. I think that, certification can be utilized in any setting, but also want to clarify that in terms of the grant itself, there are eligibility requirements in order to get grant funding. That said, certified wellness coaches can be utilized anywhere and everywhere that they have use and that they could be part of a care team or organizations see utility for them. But in terms of reimbursement outside of the school setting and multi-payer fee schedule, that's really something that will be developed in the coming year and is better suited for how that will be integrated to DHCS. So we can circle back around on that as well. But yeah, absolutely. There's use for wellness coaches we kind of see anywhere and everywhere.
All right, thank you. All right, here's a good question. Regarding eligibility, does the community-based organization need to provide services organization need to provide services to a school? We are a rural Indian health clinic that supports youth in the schools as is needed. We do have an MOU with our local university and host student interns, but do not provide services to the university. Would either of those make us eligible?
You will need to form a formal relationship with the school, whether it's a K through 12 or a university.
All right, thank you. Let's see. Let's see here. And we've got about just a couple minutes left for questions, making sure that trying to make sure that we answer them all. We do have a lot of repeat questions right now, so I'm making sure that we walk through that and try to make sure we're answering questions that we haven't already spent time on, if there are any. There's one. Can a graduate clinical intern's field practicum placement be used to meet the requirements of employee?
Repeat the question.
Can a graduate clinical intern's field practicum placement be used to meet the requirements of employee?
So to clarify, yes, when we talk about becoming certified, however, when you're talking about employees that would be hired under the grant, they have to have a minimum number of hours, as been described in his presentation, of 150 hours for a certified wellness coach 1 or 300 hours for a certified wellness coach 2 to become designated as registered and work in that setting with a stipend as laid out in the grant application.
All right, thank you. And I know we've answered this before, but there are still questions popping up on it. Can a group of community organizations submit a collaborative application with a lead agency?
The lead agency does not need to be the employer of record of the wellness coach. It needs to be a formal relationship between a non-education setting and the educating institution. I hope that answers your question. Good.
Thank you, Anne. All right, and I'm going to take 2 more questions, and then we're going to transition to our end of the webinar here, our closing. Matthew asks, we are currently hiring 10 wellness coaches as a county office of education based on the HCAI job description, each with varying experience. Would they be interns? And then it also asks registered.
I think I can address that. In terms of the registered certified wellness coach versus certified wellness coach, in functionality, in terms of being a certified individual, they are certified. They just have differences in the total number of hours. How employers are bringing them on is up to them, whether they want to hire registered versus certified, registered certified versus non-designated. In terms of the internship, or the stipend rather, that is geared towards augmenting training. So that would often be applied towards those registered individuals. And if that doesn't answer your question, please reach out to us and we can make sure that we're understanding the unique case to give you more clarity.
All right, thank you, Ben. And the last question for today is the grant amount for the Certified Wellness Coach Employer Support Grant a 12-month or 18-month grant period?
It is an 18-month grant period, and Chris, the webinar goes till 3.
Oh, do we? That's right.
Yeah.
We did a whole 2 hours for this one. I'm so sorry. I'm used to our 90-minute format. Good. We actually are working through the questions and near the end. So do have another question that popped up right at the end here. Do those with an intern designee need to have already completed their AA, or can they be working toward it while acquiring hours? I am thinking of a pathway for the many school employees that are doing this work but may not have completed an AA.
In order to qualify and apply for certification, they will have needed to complete that degree. That said, we are looking at ways to potentially do continuing education, dual enrollment opportunities for this type of for this type of situation. So again, our certification will continue to kind of be expanded upon as we have more and more individuals in the field, and as we spend more time creating that pipeline with our high schools into our associate's degree at the community colleges and beyond.
Perfect.
Again,
Thank you.
always encourage those to reach out if they have specific cases, use cases, and want to chat through if they're eligible for certification or not.
All right, thank you. This question has come up more than once. Can a bachelor holder with a medical or a medical certified peer support specialist meet the criteria for the grants? The question is the question I have on this question is it as a supervisor or as a certified wellness coach? That's not clear to me.
So I'll let Ben address the question as to qualifications for a certified wellness coach.
Yeah, these individuals would need to apply and be a certified wellness coach in order to apply. We're not accepting other certifications. So this individual would have to go through the certification process, meet those eligibility requirements in order to become a certified wellness coach, and then have those employers be able to apply for the grant specifically for those types of CWCs.
All right, thank you. Since the online application site is showing pending, and when will the online application become available? Michelle, is that a question for you?
Okay, the application is available now.
Yeah. Vera, go ahead and email us with the problem that you're having, and we'll try to work with you to get your situation taken care of. Thank you, Michelle. All right, let's see. Can you please clarify if the supervision of the CWC needs to be in the indirect cost section, or if we can include that in our staffing section? She recognizes we've answered that question, but they did miss the answer on that.
So supervising personnel are covered in the supervisor, a role as either supporting a wellness coach, certified wellness coach, 1 or 2, or supervising interns, which is your registered status certified wellness coach. If you, we don't cover any other personnel categories besides the wellness coach intern, and supervising staff.
Okay, thank you, Ann. And I see a lot of these questions are actually asking about when will the certified wellness coach application become available, and so that's a that's a different question, Ben.
Yeah, coming soon. We are diligently working on that now. Our target is in February, and we'll be having a lot of communications around that on our cawellnesscoach.org site and ways to stay informed. So highly encourage individuals. We will post those resources, but go to that website, click on the Stay Updated so that you can be part of that listserv and be apprised of that information as it comes out. But we're hoping that within just a few short weeks, that'll be live to begin applying.
All right, thank you. Let's see.
Let me also, while you're looking, Chris, at the questions, let me build on what Ben said to say that applying for this grant does not mean you have to have the personnel in mind on staff or ready to be hired. And if you have staff that you want to recategorize as wellness coaches, they will have time between now and the launch of the execution of the grant to secure their certification.
All right, thank you. Let's see. One of the questions here is, and I've seen this a couple times, can we view a paper version of the application before officially starting the application online so we can see all the required fields and information needed ahead of time? And this is a question we get frequently. Michelle?
That I'll have to refer to Jessica. I'm not sure if we have a print feature while you're completing the application. Jessica?
I wish we did. We do not. And so the best thing I can tell you is this webinar will kind of give you, some guidance about things that you want to put together. I know on those scoring guides, we sort of asked you to consider, what locations are you going to have wellness coaches at? Be prepared to tell us those address. We're going to ask you for some information about languages spoken by your current staff. So you'll want to have, those details ready. So some of that's in the slides, which is why we host the webinar. But the rest of it, it is just opening up the application. The benefit of a digital webinar is we get out decisions faster. The downside is there's no paper copy to preview. I do think it is worth noting that you can start and then leave the application. So you don't have to have all the time in the world to sit down at once. You can log in, kind of do a preview, see what's there, take down your notes for yourself, and then come back when you have more time. And as Anne mentioned, you have almost 2 months for this application period. And so, yeah, preview it, this week if you can, when you have a moment, and then take time, come back when you have all the details. So thanks.
And then I'd like to add too, if you ever have questions while you're completing the application, just reach out to us. We'd be more than happy to help you.
Perfect. Thank you both, Jessica and Michelle. And again, we will go over this, but if you don't feel like you're getting a question answered, or you have a very specific situational question, our email is wellnesscoach@hci.ca.gov. That will be at the end of the presentation as well. Next question. While coach intern collecting field experience, would these times be billable for all payer?
So that is, again, just to reiterate that the wellness coach is not yet part of the all payer fee schedule. That is something that's intended to be added in January of 2025. We do encourage you go to the DHCS website and specifically just even type in Google, and we can provide that link as well for the multi-payer fee schedule. It will list the current types of providers and their services that currently are reimbursable through that. So we highly encourage individuals to go check on that to see if they have specific provider types that do qualify for reimbursement already. We are developing out the state plan amendment so that we can be part of the multi-payer fee schedule this coming year. So we'll be learning a lot of information this coming year, but we don't currently have the rates for wellness coaches or exactly what the specifics are in terms of how that will be added. So stay tuned.
Thank you, Ben. And along with that, and I see a question here that was answered, but I think it's worth saying to everybody on the webinar, if you have signed up for the best way to stay in the loop on what's going on with certified wellness coaches is to sign up for the email list. You can find that on the Certified Wellness Coach website, and you will get emails regarding all of the updates as things happen. So if you haven't, please sign up for that email list, and we will keep you up to date. All right, next question. If you have a bachelor's in criminal justice, working towards a graduate degree in counseling psychology, and work in an organization that supports families of youth with a mental health diagnosis, should the individual apply for the wellness coach certification or focus on the organization applying as an employer, or both?
I'm going to go back and say that seems like a pretty specific and detailed case. So please reach out to us and we can chat through that. And again, if just kind of blanket statementing, if there's things that don't directly align with what we're stating in our certification right now, please reach out to us so we can make note of that. And then we can address those in the coming months.
All right. Thank you, Courtney. Go ahead and reach out and we will help you figure out the specifics.
And also, just want to clarify that while this is just about the grant, that we are going to have opportunities for our students in the future as well. We are going to create scholarships, a scholarship program for our individuals that need to complete their associates or bachelors. So just want to let you know that there are opportunities for potential applicants as well to support them. So it's not just our employers, but right now we're just talking about kind of the demand aspect that we mentioned earlier, which is specifically for our employers. However, we definitely want to support our wellness coaches and making sure, again, potential applicants are eligible, and for those that need to meet those requirements, that we are providing resources for them to do so. So don't hesitate to reach out to us. And then as we post those resource links, check out our website. That has a lot of information for potential applicants for wellness coaches. So we're supporting our employers just in this grant, but we'll be sure to support all of our applicants in the coming months. But don't hesitate to reach out to us now.
All right. Let's see.
Let me address a question that's relating to Medi-Cal reimbursement. First of all, the multi-payer fee schedule under Medi-Cal, it is a freestanding reimbursement mechanism intended to last beyond the CYBHI, and the all-payer or what's called multi-payer fee schedule will apply to wellness coaches beginning in January of 2025. At that point, it is our expectation that it will include the registered certified wellness coach. We await news from our partner agency, GHCS, on that decision.
All right. Next question. The information online indicated individuals working on their AA could apply but would need the degree before the certification was issued. Please clarify. I believe we spoke to this, but Ben, it looks like there's still some question about that.
Yeah, for those that are unsure about certification, please reach out to us. For the workforce pathway, I think the question was around is that these are those that are already in the field, that already have the degree and have the hours. So you're essentially pre-qualified to apply for certification as soon as it opens. We have others that are potentially finishing up their degree or very early on in their career, haven't yet met those hours. They would be more in the education pathway. So again, we're kind of building both the supply of our coaches as well as the demand for them simultaneously. But if you're unclear, check out our resources. We have more information on what certification requirements entail. And then if that isn't clear, please reach out to us and we will be sure to chat through your specific use case and see if you're eligible now or what you would need to do in order to qualify once that's live.
Thank you, Ben. All right, I see a question in the chat saying they asking about a couple things, saying that they just joined. The webinar is being recorded and it will be available. If you registered for this, you will be getting an email once the recording is posted online. The slide deck will also be posted online at the same time. So you will be able to get access to everything that you missed. All right, questions are starting to slow down. I think we've gotten through most of the questions. And if there are, I'm going to give Anne, it looks like you have something to say.
Yeah, there's a question about specialty mental health services versus the multi-payer fee schedule. How this workforce is reimbursed is complicated. The intention is that it's a special set of services, prevention and early intervention, which have historically not been covered by Medi-Cal, just standard fee-for-service and organized health system fee for Medi-Cal. For that purpose, the multi-payer fee schedule applies. Specialty mental health services is something organized through each county. If a county decides they want to support using certified wellness coaches to deliver prevention and early intervention to their clients, that is always an option. We do not preclude that, nor is it intended that the fee schedule negate that option.
Thank you, Anne. And thank you for pointing out a question that we did miss asking and answering. There was a question about how long organizations must employ the person after the grant is over.
A condition of the grant is sustainability letter. The intention there is we require, as part of the application, submitting a letter of the intent to sustain the personnel. We recognize that availability of the fee schedule, this whole thing is predicated on the multi-payer fee schedule, and anticipate that will provide your revenue stream to continue employing these personnel.
All right, and if there are any other questions that you felt like we've missed, please get those in now. We're doing our best to make sure that we've answered all of the questions without trying to answer the same question 3 or 4 times. I know people come in and out of these webinars, and sometimes it's hard to know if your question's been answered or not. All right. And let's see here. Another question: for the sites we list in the application, do they have to be school sites or can they be school links, nonprofit sites? I believe we spoke to that a while ago, but it might be worth reiterating that one more time.
The grant is for education in the form of community offices or county offices of education and local education agencies, as well as their partner community agencies in the form of school-based arrangements and school-linked arrangements. So those are the conditions for applying for this grant program.
All right, thank you, Anne. And there's another one here. If we have an MOU with the school, does this allow us to be eligible? Yes, we have addressed that, and that is one of the ways of demonstrating the relationship with the school. Okay. Let's see here. Make sure the post here. We've talked about the MOU. That's good. All right. Any last questions that we haven't already addressed? Give people just one more minute to get questions in. Again, if you haven't already, please check out the Certified Wellness Coach website. Please join the email mailing list, and if you do have questions, wellnesscoach@hci.ca.gov. And again, today's questions are going to be revolving around the employer support grants. We know that everybody has lots of questions on certified wellness coaches, and we will be having additional opportunities in the future to get all of those questions answered. All right, looks like we are coming to the end of that. So thank you everyone for all of those questions. Amazing participation, amazing questions. And we're really excited at all of the interest that's out there. Again, wellnesscoach.hci.ca.gov. If you have more questions, and as a reminder, we will be posting the recording of this webinar, the slide deck, and all of the other resources on our website. We will be emailing you. If you've attended this webinar or signed up for it, you will get an email. Typically, that takes us about 7 to 10 business days to do so. On the next slide, we have some, excuse me, I believe on the next slide, we're going to get some closing thoughts from Sharmil. And then we'll have all of our final resources available at the end. So with that, I'm going to hand it over to Sharmil for closing thoughts.
Thank you very much, Christopher. Really appreciate everyone here today. So I want to say a big thank you to our Wellness Coach team, our communications team, and again, to all of you for spending your valuable time with us today. Collectively, we are taking steps to support our youth and improve their lives through this much-needed profession. We are hopeful that you see the impact the Certified Wellness Coach can make, and after today, have learned how you, as an employer, can receive support to recruit and hire these much-needed professionals in your organizations. On behalf of our team, myself, and HCAI Executive Leadership, we thank you. I will now turn it over to Christopher Rowena, our facilitator, to wrap us up.
Fantastic. Thank you, Sharmil. All right. Well, again, thank you for joining us for the HCAI Certified Wellness Coach Employer Support Grant Program. If we can go to the resource slides at the end, we'd like to highlight those. Like, are our slides stuck? Or is it just stuck on my screen?
We're displaying the resources slide.
The resources slide, yes, please. All right. On those resources slide, you will see that we have the grant guide, the resource guide, a wellness coach overview, frequently asked questions, a link to the application, and a link to the wellness coach website. And then additional resources, you can find the multi-payer fee schedule and a link to the Children and Youth Behavioral Health Initiative, which has what initiated this wonderful program. You can find the links to all of those resources on that resource slide. Again, this will be posted on our webpage. We would like to invite you to sign up for our newsletter. And it looks like we're still having trouble getting synced to the slide, Alma. If you want to just pull the slides down and reload them on the resource page. I think for some reason it got stuck. Yeah, we would like to invite you to sign up for our workforce monthly newsletter, where you can stay up to date on all of the things that HCAI offers for health workforce. You can sign up for that online. And then additionally, we have all of our social feeds that you can follow us on. And once again, lastly, wellness coach at hcai.ca.gov if you want to ask any more questions of our wonderful team. We do encourage you to visit our website to discover all the great resources that HCAI offers. And as a reminder, the application cycle does close on March 15th. We'd like to thank you all for attending today. We're excited to be able to offer this program as a part of all of our health workforce development efforts here at HCAI, and we're grateful for you being with us today. With that, we conclude today's webinar. Have a wonderful day.